Hi. When I tell people that I work in a nursing home, the first thing that I usually hear is, "That's so sad. That must be really depressing for you." And every time I hear that response, I remember that I used to think that until I started working at one. Because many people are picturing the end of someone's life. They're not thinking about the life that's still there. I think about the stories, the resilience, and the people behind every wheelchair and behind every diagnosis. Almost everyone we know will know someone who's having to go to a nursing home one day. Maybe a parent or a grandparent or a spouse or even ourselves. Understanding what nursing homes are really like help us make informed decisions and appreciate the people who do live there and the people who work there. I've been an LPN, a licensed practical nurse, for almost 15 years now, working in nursing homes. And during that time, I've truly witnessed heartbreaking losses, remarkable recoveries, and countless moments of compassion. Those experiences have given me a firsthand understanding of what life inside a nursing home is really like. Many people's perceptions of nursing homes are shaped by misconceptions, honestly, rather than reality. Today, I'd like to challenge those myths and share a more honest, more compassionate picture to you of the people who live there and the professionals who care for them. Today, I'm going to discuss who all resides in these nursing homes, explain what nursing and nursing assistants do, and address a few myths that nursing homes that you may have. So, who lives in nursing homes? One misconception is that they're older people, people with dementia, who are there to die. The truth is, that could be further from the truth. Nursing homes care for people of all ages, recovering from strokes, serious injuries, serious surgeries that affect their mobility, in addition to chronic diseases that can no longer be managed at home. Many are there temporarily only. In fact, according to the American Healthcare Association Fast Facts, 6 out of 10 nursing homes, admissions, that is, are for short term stays only. Even though Medicare will pay up to 100 days, people are staying an average of 25 days there. Then once they gain their strength, they return home, or a social worker helps place them in a group home or another facility if they can't any longer be at home. Remember, if you do hear someone say they put grandma in a nursing home, she's probably there to heal, not to die. It's not where her life ends. The goal ultimately is to go home. Nurses, in addition, so my apologies. Now we've talked about who lives in nursing homes. Let's take a closer look at what nurses and nursing assistants do. Nurses, in addition to administering medications, they perform head to toe assessments. That includes skin checks and fall risk assessments. They obtain vital signs, perform wound care, IV therapy, they draw blood, they educate patient and their families on new diagnosis, report to the doctors any new issues, all while being ready to respond to medical emergencies at the flip of a coin. During the day, that could be up to 30 patients, sometimes 60 if you work at night. Certified nursing assistants are the heart and soul of hands on care. They bathe patients, they perform toileting on those who can't any longer go to the bathrooms themselves. They help feed patients, they help therapy with mobility exercises. Most importantly, what they do the most is they provide that emotional support with residents, which is just as healing, if not more than, any other medical treatment. They're often the first ones to notice small changes because of how much time is spent with patients. Although nursing homes provide essential care, many misconceptions do still exist. Let's talk about it. A common myth I hear is there's not enough staff to support good care. Reality is staffing shortages are real and they affect healthcare everywhere you go, not just nursing homes. According to Justice and Aging, who is a well respected organization who specializes in elder law, they state residents have the right to voice their concerns through a formal grievance process where they believe care is being affected. Behind the scenes, facilities work to fill these open shifts by calling in staff, asking managers to help on the floor, getting agencies to help. Even during difficult staffing periods, nurses and CNAs remain committed to providing safe and compassionate care. Nursing homes aren't perfect, but they're not indifferent or ignorant either. They really try. A second common myth I've noticed is every nursing home provides poor care, they state. While some nursing homes struggle, a lot provide exceptional care daily. I work in one. The goal of nursing homes isn't simply to care for people, it's to help each resident achieve the highest quality of life and greatest level of independence as much as possible. Nursing homes are regularly surveyed, complaints are quickly investigated, and deficiencies require corrective action immediately. Thousands of nursing home staff diligently, quietly dedicate their lives to protecting the dignity and safe of those they serve. A final myth I hear often is nursing homes are a dumping ground for hospitals. The truth is, they are a vital link in the continuum of care. The article, Gatekeeping Power, coming from a skilled nursing skilled news, remains up to date on nursing home current events and policy changes. They explained that the 3-day hospital stay requirement rule for Medicare can delay access to skilled nursing care. Proof that they're not a dumping ground. They keep hospital beds occupied even when patients are ready for therapy, which is a disservice to nursing homes that have low census or hospitals that have high census. And it happens daily. Nursing homes are a bridge between the hospital and home for many patients, not a place just where hospitals dump patients. So every time I walk through those doors, I know behind every wheelchair is a story of hope, not just death. Let's never forget, because one day that could be someone that you love or even be you. Thank you for listening.